So guys, today we are going to learn about Bell's palsy. Now Bell's palsy has two other names, that is seventh nerve paralysis and the facial paralysis. So these are the two other names of Bell's palsy, that is seventh nerve paralysis and the facial paralysis. Now beginning with it, we'll begin in from introduction, then definition, then I'll tell you the etiology. After that, I'll tell you the clinical features of Bell's palsy. Then we'll discuss about the syndrome associated with the Bell's palsy, and after that the treatment plan. So now, beginning with this introduction. Now first let me tell you about what is Bell's palsy, or what is the seventh nerve paralysis. Basically, Bell's palsy is one of the most common neurological disease. It is the most common neurological disease affecting the cranial nerves. That is, this is basically a neurological disorder, and it is the most common among all the neurological disorders. It is the most common, means it generally occurs. So affecting the cranial nerves. Now Bell's palsy is the most common cause of facial paralysis worldwide. So Bell's palsy is basically the most common cause of facial paralysis also worldwide. Now the third point is that Bell's palsy was first described by Sir Charles Bell. He was the first one who described this disease, who studied this disease and described it. So it was described first by Sir Charles Bell. Now B for Bell's palsy and B for by the name only, this name has been given. So this is Sir's because of it was discovered basically by Sir Charles Bell. It is a diagnosis of exclusion. What do you mean by diagnosis of exclusion? It means that there is no test to diagnose the condition, but there are tests to rule out other conditions that might be similar, and if these tests are negative, then we can diagnose this means that it is a diagnosis of exclusion, means there is no such test to diagnose that whether a person is suffering from Bell's palsy or not, but the other condition, when they are ruled out to be negative, when we compare, then we give the diagnosis of Bell's palsy. Now coming to the definition, we did with the introduction, now coming to the definition. So definition is basically, you need to cram it up actually, and I'll explain you in a easier way that how you can remember it. So Bell's palsy is defined as an abrupt means a sudden, isolated means a separate, and unilateral peripheral facial nerve paralysis. Basically it is a paralysis of one side. It is a paralysis only of one side of face, that is unilateral, and it occurs suddenly and in an isolated separate manner. So based on the clinical features, you can just learn the definition, that the site, the onset, basically the onset is sudden, that is abrupt, it is isolated, and the site is unilateral, and peripheral nerve facial paralysis without detectable causes. Basically the cause of this disorder is not exact. It can occur due to various reasons. Now coming to the etiology. So the etiology, there are three etiologies. First is idiopathic means unknown. We really don't know the etiology, that why it occurred. Second one is infectious, like in case of herpes simplex virus, if the person has been infected with the herpes simplex virus, then what happens, this remains latent. The herpes simplex virus, it remains latent in the sensory nerve roots. So when it remains in the latent, that is dormant, in the sensory nerve roots, then what happens is that it will reactivate, it will get activated, and it will affect the nerve, basically the seventh nerve, and leading to the paralysis of that. Now inflammation is also the cause of the facial nerve paralysis, like edema causes the nerve compression. When the nerve gets compressed, so it will lead to basically the disorder of the nerve, basically, and leading to the paralysis of it. So these are the three causes, these are the three etiologies. Now coming to the clinical features, that how it presents or what area it affects, and what age group people it affects, what gender it affects, basically clinical features. In clinical features, I'll tell you all about. So clinical features of Bell's palsy is all about facial paralysis, that is its onset. Firstly, you can just jot down that it will be easier for you and will help you in grabbing more marks if you will write in an order, like first introduction, then definition, then etiology. So it will be helpful for you. So now coming to the clinical features, it's all about the onset, then site, then affected, site affected, then age, then sex, then okay. So now coming to the clinical features of the person affected. So basically it affects the sex which is affected is women are more affected in Bell's palsy than the men. Then age is middle aged women, although no age group is so basically it affects the middle-aged people. Now clinical feature of the lesion, you'll tell about basically the onset, the site. So onset is basically arises more frequently in spring and fall than at other times. So what is the main feature of this is that हमने ये पढ़ लिया, we studied that it basically affects the women of middle age. Now its onset will be during which season, with the spring and the fall, okay, and it may develop within a few hours or may present when the patient awakes in the morning. So basically it occurs within a few hours and basically affects in the morning. The onset is abrupt, we have already studied. So the onset is abrupt, occurs mostly in spring or fall time, and within few hours. Onset is abrupt, that is sudden. In some cases, it is preceded by pain on the side of the face involved in that is within ear, temple, and mastoid region, and at the angle of the jaw. So basically, this disease is basically preceded by, means firstly the pain will occur. The pain will occur on the side of the face, then ear, temple, mastoid angle of the jaw region. Now next is sight. Sight will be basically unilateral, and I've already told you that it affects one side of the face. Now the mnemonic to basically remember the this clinical features of Bell's palsy is that S the five S of Bell's palsy are spring, then सुबह के time में means in the morning. This I've made for easy, if to make easy for you guys. S for sudden, S for she, S for single, sight affected. So this is a very easy mnemonic which will help you to memorize whole of the Bell's palsy, I would say, because it affects the single side, it affects female, the onset is sudden, it occurs in the morning and basically in the springtime. So this is very 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 easy for you guys to remember. Now more specifically, areas of the face affected are forehead. Then this also have made easier for you guys. I have written this in the order starting from the top part of the face, that is the forehead, then the eyebrows, then the eyes, then the nose, that is the nasolabial fold, then the corner of the mouth, and after that the cheeks. So in an order I have mentioned this: forehead, eyebrows, eyes, nose, corner of the mouth, and the cheeks. So these areas are affected. Now the next part I'll cover in the next video.